Hello and welcome to episode 8, season 3.0 of Medical Today with me, Jared Ratnam. On the show today, something very interesting on fractures and sprains. Have you ever put heat on a fracture or sprain? Well, we've got some news for you and a video to help you out with regards to knowing more about sprain, fractures and using or applying heat on them. Also on the show today, we'll be talking about gynecological disorders. Dr. Sharina from KPJ Damansara Specialist Hospital will be joining us. But for now, a very interesting interview on a comprehensive eye examination. Now, all of us take eye examinations very lightly, but a comprehensive eye examination is what we need by a trained optometrist. I did speak to Khairunisah Muda, an optometrist and also the regional sales manager for Menara Optometry Center, Sendirian Berhad. She gave us some insights as to what an eye test is or a comprehensive eye test is all about. Let's take a look at that interview. Khairunisah, thank you very much for joining me in this interview to talk about eye examination. Of course, you are a qualified optometrist, and yes, it is something that is very important that we all go to an optometrist who's qualified and who knows what he or she is talking about with regards to eye tests. Now, when you talk about an eye examination, they say you need to get a comprehensive eye examination. So maybe you can walk us through what a comprehensive eye examination is.
Okay, thank you, Gerard. So I'm sure that you have been through the comprehensive eye examinations because obviously you're wearing glasses now. Mm-hmm. Okay, so comprehensive eye examinations should be properly done by the optometrist. Okay, and the comprehensive eye examinations include the ocular history. During the case history, when we interview the patients about their eye problem, it has to be properly taken and establish the establish the chief complaint. Why are they coming to us? What is that must properly established. So
taking the history is establishing the chief complaint. Exactly. And working forward from there.
Exactly. Mm-hmm. And then we start we start doing the investigations. So investigations is to check the visual acuity. Mm-hmm. That is how how clear the patient can see.
The ability of the eye to
exactly,
see clearly. Yeah.
To see clear, and also the refractions. Actually, refraction is part of investigations because there is many more eye examinations that we doing during the comprehensive eye examinations, namely like binocular visions. Mm-hmm. That is, the both eyes are working together. We have to establish that.
So the easiest way to explain that would be to think of binocular vision as both eyes working in sync.
Together. Yeah, exactly. Yeah. Okay, so and also we have to see whether there is a muscles weakness during the we call the extraocular muscles. When they move their gaze towards your right side, left, up and down, that's also we need to see any weakness of the extraocular muscles. Mm-hmm. And we also check the color vision test to pick out whether they have a color defect.
Right. But they're always asking you to pick between red and green
okay.
every so often. Why is that?
Oh, that is actually part of refraction. Mm-hmm. To determine the power is not over-corrected or under-corrected. Right. That is one of the method which is during refractions, mm-hmm. But not the color visions exams. So the color vision is, when there is series of plate where you have, they have many colors in there and you have to distinguish what number is that, mm-hmm. and also some of the figures that you have to distinguish from. Then if you pass, then your eyes is okay.
Right. I think the thing here is when you go for an eye test, how mm-hmm. long does a comprehensive eye test take?
So it depends on the chief complaint that there will be more investigations that we need to do, and sometimes we have to look inside of the eye, the anterior segment of the eye and also the posterior segment. That is our retina. Okay, so sometimes the blur visions is not because of you need a pair of glasses. It may be more. It can be because you have some defect in the fundus, in the retina, namely those who have a diabetes, hypertension, who have a changes in the eye.
I've been hearing this theme a lot. When we talk about eyes, everyone's worried about diabetes first, but we'll talk about that later.
Yeah.
Now, they say when you come for an eye examination, your eyes have to be well rested. So they say that, or at least people I've spoken to say that you need to come just after you had a good sleep at night for an eye test. Do you ask for things like this, especially for people coming in for an eye test?
Yeah, that's very true, Gerard, because sometimes when you come late in the evening, to have your eye test, you have been using your eyes for the whole day, in front of the computer. You have an eye strain. So then when we check the eye, when we perform an eye examinations, the patient becomes very tired. Right. They cannot respond well, and the eye fatigue, because when you do a lot of close work, there is a lot of convergence happen during this time, the eyes turning inwards. So because of that, they cannot respond well. So that's why it's important when you come to have an eye examinations, you must rest well so that we can determine the correct power.
Now, the other thing they say that an eye test has to be essentially done annually. Now, what's the reason for this, or is there a better explanation to this?
Okay. So it is very important. The public need to be aware that, the eye examination should be done annually, because, because I had just, I had a meeting just a week ago about with the Persatuan Academy Optometry Malaysia, and we were discussing the growing issue in Malaysia nowadays. There is a myopia awareness in children and digital eye strain due to the the digitalizations era, and also diabetic retinopathy, because the diabetes has increased a lot, the cases in Malaysia. So we have, as an optometrist, this is our role, to make sure they always maintain their good eyesight. Okay, so that's why it needs to be done, annually. So in kids, for example, it's not only when they come to us, we've checked the eye and we give a pair of glasses and that's it. No, it's more than that. We have to see them, because we have to monitor the power of their eyes, so that, because having high astigmatism, having high myopia or short-sightedness, definitely it can reduce their performance at schools. Okay, so their performance, they can't see well, and also those who have working in nowadays, people use a lot of computers. Okay, when they have digital eye strain, definitely their performance also reduced. Right. So in adult, those who have diabetes, some people, they don't perform the medical checkup. They wouldn't know that they have diabetes. But when we check their eyes, we can see the changes in the retina. So then we refer accordingly to the ophthalmologist. Okay,
so if someone comes to you now and says, look, I want to check my eyes, it's a little blurry, and you do a retina scan, and can you tell if the person has diabetes?
Yeah, because that's what we call the features of diabetic retinopathy. So there will be, when we use a fundus camera, then we check inside. We can see some aneurysm of the blood vessels. We can just recently there is a bleeding in the eye, and also changes due to diabetes. We can detect, but we can't treat.
Then you were mentioning a camera that's used. What camera is that?
Fundus camera.
Right.
There is a special instrument which is to check in the eye retina, which is inside the eyeball.
Right. So this happens when you come for your comprehensive eye test.
Exactly.
Now,
yes.
what is the other one they're using, especially when you have to look into a little binocular and you see a balloon or a house in a distance?
Yeah.
And that, what does that do?
That is autorefractometer, whereby when you look inside, computer, we will estimate what is your power, whether you have short sight, whether you have a long sight, or whether you have an astigmatism. So it gives us the idea of your...
An approximation.
Approximations, yes.
Right.
Correct, okay.
Now, with digital eye strain, I also understand that the technology of lenses are becoming better to deal with digital eye strain. How much better has the technology of lenses moved?
Okay.
Or how much has it come forward?
All right. When we talk about digital eye strain, is the patients come with a certain symptoms. They have dry eyes, they have neck pain, they have eye strain, they have headaches and sort of things, So when you talk about the lenses which help, not only purely coming from the lenses. So, the digital devices emitted blue lights. Okay, so with the lenses, blue light coating lenses, blue coat lenses, it will filter some of the light, not all, but filter some of the light, and it will give you comfort to your eyes.
Right.
That is the lenses. But for this digital eye strain, more often we have to give a vision therapy to improve, because it always comes with the weakness of the muscles. It comes with the accommodations which is reduced. So optometrists usually, if they detect this digital eye strain, we give visual therapy.
What's interesting about advice given by optometrists or trained optometrists is they talk a lot these days to the younger generation about lenses, about especially contact lenses. They always say, be careful where you get your contact lenses from, make sure you get the right ones. Why is there so much of an emphasis on lenses?
Okay, so contact lenses, as what you mentioned just now, is invasive in optometry because it touches your cornea direct. Okay, if you don't have a proper care regime, the contact lenses will be staying with all the protein deposits, all the microorganisms. So later on, it will lead to another complications to your cornea. Okay, so contact lenses also, if it's not, if the patients did not undergo the proper eye examinations, it will give them harm rather than, benefits. Because when they have a dry eyes, they are contraindicator for contact lenses wearer. And then, some people, they are wearing
dry eyes would be a contraindicator for lens wearer.
For the lenses, contact lenses. And if they wear for long hours, lack of oxygen supply to the cornea, that also can lead to complications. Not properly taking care of, the care regime, for example, cleaning the contact lenses, storing, and hygiene, everything contribute to these complications. And the end result of the complications is the eye infection, whereby, once the eye infections happen to the cornea, so the cornea is no longer transparent, it became opaque. So it blocked your visions. So when blocking the visions, no glasses, no power can help this patient to see clear. So this is very important for the contact lenses wearer.
Well, interestingly enough, you talk about having a comprehensive eye test done. Now, when you walk into an optometrist, you get a lot of people who are trained optometrists. You also get a lot of people who aren't trained. They worked in an optometry, but then again, getting the approximation, once you've given someone a test, an eye test or comprehensive eye test, so to speak, when the person puts his new eyeglasses on, he or she needs to feel comfortable. And some people get a pair of glasses and then they feel like it's too bright, or they start getting headaches. What do you look out for when you collect your glasses and you start wearing them?
Okay, so number one, with this, upon delivery, when the patient starts, having a new glasses and then put it on, and then, what you were saying just now, they start feeling discomfort.
Discomfort, okay? A pull on the head or in the middle of the eyes, so on and so forth. Yeah.
So, number one, we need to recheck the refractions, whether, and we need to recheck the parameters of the glasses, whether it's done according to what we measured earlier, your pupillary distance, your height and everything.
So could that have changed if, could that have been discomfort, or could the discomfort have arisen because of the fact that I did not rest properly, or it was the power was taken incorrectly because I was either too tensed or my eyes were too weak at that point during testing?
Okay, now this is very important. That's why optometrists will not prescribe any power if they notice that you are not in a good condition. So normally they advise you to repeat the eye examinations to another day because you are not fit on that day. And another problem, back to the adaptations of the new glasses, sometimes when you put on a new pair of glasses, your brain is actually learned to adjust with the new power and a new design. So it takes a while. It's not like automatic like that. Some people take very fast to adapt. Right. Some people, it takes a while because sometimes there are at the side there is a blurry images or distortions. So the brain needs to learn to ignore this distortion area because the glasses, the optical power is at the center. So then when you
it takes a while to acclimate.
Exactly. So the brain needs to adjust to a new design or a new glasses. So
now with all of us, I guess when we go to an optometrist, we get simple advice like, if I'm wearing a pair of glasses, I need to take it out with both hands. I need to make sure I'm cleaning it properly. Now, when you say you need to clean it properly and you need to take care of your eyeglasses, what do you mean? What are the main problems with regards to us not looking after our glasses?
So when you have a pair of glasses, normally people tend to remove the glasses with one hand. Okay, so it will alter the shape of the temple. It will be it will be out of shape. So when you wear the glasses, then the glasses is not placed, exactly where it's supposed to be. That will give you, not comfortable. Okay, and then cleaning the lenses, because the lenses, normally you can buy the spray which is provided in optometry center. You can spray on and clean it with a special cloth, because more often people are using like their tudung, their baju,
the handkerchief
to wipe it, that will cause scratches on the cornea, on the lenses, and therefore it will block your visions.
But because people are paying good money for good lenses these days, I think that awareness to look after your own glasses has started to slowly come about, and you see people buying like lens cleaners, like ultrasonic lens cleaners, so on and so forth. Are those things recommended to be used at home?
Okay, now depends. Okay, some lens cleaners, they have high chemical in it, so that will damage the coating of the cornea. The lens as well.
Right.
Use those which is recommended by the optometrist from the optical shop, because that is sufficient to clean the
So the last thing you want to do is buy something online.
Okay. Buy online, okay.
Yeah, because a lot of people are doing things like that now. They're buying lenses online, they're buying frames online without even knowing the proper size. Now they also say, and this is very much said in the Western world, when you buy a frame, the frame needs to suit your face. In the next 1 minute, what can you tell us about simple tips on buying a frame or picking a frame for yourself?
Okay, buying frames, you have to try it on. There is no such thing, you know, put it in, because, you know, you have to feel it, whether it's comfortable or not, whether it sits nicely on your nose, whether it's, you know, placed nicely, you know, around your temple. So you have to feel it. It's not like, you know, buying clothes SML size. It's different. Because this is where we need to measure properly the optical center of your eyes coincide with the lens. So I don't recommend to buy, you know, online things, you know, because more often you will get disappointed because it did not suit you.
Right.
So in optometry center, normally we give you a few for you to try, and you feel comfortable, and you feel beautiful, you feel handsome.
Right.
So
on that note, it's always important to feel beautiful and handsome.
Handsome, yes.
Khairunisah, thank you very much for taking time off from Menara Optometry to join us right here on Medical Day. Thank you so much for the advice.
Thank you, Gerard, for inviting me.
That was Khairunisah Muda, Optometrist and Regional Sales Manager for Menara Optometry Centre, Sendirian Berhad, joining us right here on Medical Day. That was an interview we had with her in a different department within Bernama, just to give it a different feel. Thank you very much for joining us on episode 8, season 3.0. We've got more interesting stuff coming your way. When we come back after the break, we'll be taking a look at gynecological disorders, all happening on Medical Today, BNC. Hello and welcome back to Medical Today, episode 8 with me, Jared Ratnam. And we now move into gynecological disorders. Joining me in the studio is Dr. Sharina Muhammad Razali. She's a consultant obstetrician and gynecologist from KPJ Damansara Specialist Hospital. Doc, thank you very much for taking time off to be with us. A lot to talk about. Yeah, and a lot to talk about when we talk about women problems. So we're just going to dive into it straight away and talk about gynecological disorders. Now, they say that in in the life of a woman, you know, at some point in their lives, they'll always face some gynecological problems, complications. Now, you know, how do we begin this conversation talking about gynecological disorders?
Okay, so
what's the most important at this point?
Well, gynecological problem is one of the most common reason why a woman would go to a GP or a clinic. So being a woman, there are so many organs and many things that you need to take care of, right from the uterus, the ovaries, the cervix, and also the vagina. So each of these organs has its own set of problems, okay? Well, some are common, some are less common. So if you're talking about bleeding disorder, menstrual problems, those are related to the uterus. Or sometimes the woman may come with abdominal swelling, lumps and bumps that they're not supposed to have. Then that could be actually a growth, which can come from either the uterus or also the ovaries. And the most common one, at least every woman has had at one point in their life complaint of a vaginal discharge. This is probably the most common reason why they go to a clinic. So that's obviously arising from problems in the vagina and also the cervix.
Right. Okay. So let's begin at the very beginning. If you want to talk about vaginal discharge, what are the common problems which lead to vaginal discharge, and why are we seeing a prevalence of vaginal discharge?
Yeah, because it's very common, because the vagina is very unique. You know, it has its own flora, organism in the vagina that's taking care of the harmony of the vagina. Certain bacteria is, you know, making sure that the vagina stays in a very acidic component. But little things can cause disruption to this harmony. For example, intercourse, menstrual bleeding, or if they've just taken broad spectrum antibiotics, so these good bacteria can die off. So the acidity becomes less, then you can get all sorts of problems, like overgrowth of the fungal, or overgrowth of the bad bacteria, giving rise to discharge.
Now, when you talk about broad spectrum antibiotics, you say, it will bring about problems where it eradicates some of the
good bacteria.
Yep, that's
right.
What can be done to change that process?
This goes back to good practice in the GP settings. You know, when people come with cough and cold, most of the time it's actually viral. So you don't really need to give all these broad spectrum antibiotics in the first instance, in the first setting. So yeah, we have to educate our GPs and all that.
So GPs, the first line of defense, need to be re-educated with regards to ONG.
A viral infection. Yep, that's
now,
right.
a lot of women in this day and age do a lot of reading on their own, especially when they find some problems within themselves. Of course, this also goes back to being private. You know, as a woman, some women like to be private, and then even if they're married or if they have partners, they don't tell their partners what's going on with their life. So sometimes you find a bit of a disharmony in a relationship because of womanly problems and because of them not being able to share these problems. Have we seen a rise in the fact that women, when they have these problems, they want to share it with other people, or especially with their doctors?
Well, not every woman is like brave enough or comfortable enough talking about their problems to the husbands or to the family. Some may resort to going to the doctor because they find it easier to talk to the doctor. Yeah. So
okay, so say let's take something as common as STD or an STI in a setting like ours, in an Asian country or in a country like Malaysia, and to tell someone I'm suffering from an STI or an STD is like a big no-no. It's like, everyone will know I had sex.
I think STI is pretty much something that they don't talk about. That's the problem when they keep the symptoms to themselves. Either they try self-medication or just leaving it until it gets worse, and that's when the problem will happen.
Right.
That because as you know, STI can spread to cause like ascending infection into the pelvis. Then they can get complications of all these cervicitis. They can get complications like pelvic inflammatory diseases, which in turn can disrupt the anatomy and all that, and eventually can cause infertility, difficulty in conceiving. So I think our women should be empowered, that they should know that if they have a problem, they should be able to talk to someone and they should get help early rather than later. For example, you're talking about STI. Let's take an example, chlamydia. Okay, so it's probably underdiagnosed because people don't really go and see the doctor for a discharge. They will wait until like the end, until they started to have fever, they start to have like abdominal discomfort and all that. Then they go see a doctor. For at that time, the infection has already spread. And once it's ascended into the pelvis, into the pelvic cavity, then it has become a pelvic inflammatory disease. So this will definitely require more urgent treatment and attention by the doctor. So it's better to seek treatment earlier than
symptoms,
later.
okay, what would the early symptoms of chlamydia be? Like you said fever. So when you get a fever, it can be for many different reasons.
Yes, exactly. Yeah, it depends on like. All women will have some kind of discharge, but if they feel that discharge is getting worse, is starting to have like I said earlier, pelvic discomfort, pain during intercourse, and the smell of the discharge is becoming very offensive, then they should seek help.
Right.
Yeah. If it's like a simple one, whitish discharge at a certain time of the month, that could be physiological. When you're getting your period, when you're ovulating, you do have some kind of discharge.
Right.
But a woman should be able to tell when the discharge is not the usual one. Yeah, that's when they need to come and seek help.
Now, the executive producer of the show did talk about, brought up this problem, uterus polyps versus fibroids. I think, while it's important to talk about that, we also need to talk about cysts. So, how do we tell the difference between the two or the three?
All right. So, fibroids are actually a solid growth that arises from the uterus. Okay. Actually, if you look at the statistics,
thick muscle tissue.
Yes. So if you look at the statistics, those days they used to say about 30% of women will have fibroid whether they know it or not. But as these women grow older, the numbers can go up to as high as 70% in the women aged 50 and above. So it's actually a very common growth in women. But unfortunately, only some will become symptomatic. So the symptoms that can happen, the fibroid can give rise to symptoms like abdominal swelling, pain during during menses, and also abnormal bleeding, like very heavy period bleeding. So that's fibroid. Okay. Polyps
so
on
top of your usual menstrual pains, you get it becomes acute.
Yes, it becomes more severe. That like limiting their physical activity. They can't go to work when they're having their period. So that's not normal. So on the other hand, polyps are actually smaller growth. Okay, it can be just a small bump or like a small little mushroom that can arise from any cavity in the body. So it can come from the nasal cavity, it can come from the stomach and stomach polyp, it can also come from the bowel and gastrointestinal. But I'm going to talk about obviously endometrial and cervical polyp.
Endometrial tissues.
Yes. So endometrial polyp tend to give rise to, again same will be abnormal bleeding.
What is an endometrial polyp?
Is an abnormal growth from abnormal cell proliferation arising from the endometrial cavity.
Right.
Yeah. So in gynae, you can have polyp coming from either the endometrium, which is inside the uterus, or coming from the cervix. So both will cause like abnormal bleeding, bleeding in between periods, bleeding after intercourse. So yeah.
So it has its fair share of problems, and you need to establish or ascertain it by checking with the doctor if it's a polyp or if it's fibroids. Now, with regards to cysts, what don't we know, or what do we now know about cysts?
Cyst is actually a growth containing mostly fluid. The fluid can be can be a clear fluid, can be straw-colored fluid, or it can also be like old blood that's collected in the body. The thing about cysts, they can become asymptomatic because cysts in gynae, cysts arises from the ovary. They can grow to a considerably large size before they become noticeable or symptomatic. Because at the first instant when there's a cyst, there's not much symptoms. Unless it has grown so big until the woman will notice an abdominal swelling. Then only they will, prompt them to go see a doctor, and voila, they already have like a 16-centimeter cyst arising in the abdominal cavity. So that's the difference lah. The presentation cyst usually will be later.
Right. Right. So fibroids, polyps, a lot of people, when they Google it, the first thing they come up with, it can lead to cancer, irregular menstrual periods, and instability of your normal cycles. There's also vaginal bleeding, there's infertility, all these things that can scare you. So what do we need to know about polyps and also fibroids with regards to how serious it can get to?
So basically, whenever a woman has abnormal bleeding, abnormal uterine bleeding, a bleeding that is like outside their period, like following intercourse and all that, they should see a gynecology, to get a scan. Okay, so that will help to rule out all this growth, and they can also some investigation can be done. For example, any woman who has had sex should at least do a pap smear. So when they come to a doctor, the gynae will see this as opportunity to also screen the patient for all these cervical cancer malignancies. Yeah.
Now, when you talk to women about, I'm just going to digress a little and talk about vaccines, because when you talk about the HPV, and all the vaccines that are required by young girls these days, or girls who are going to be sexually active.
Right.
There was a time when they said that if you're already sexually active, the vaccines won't quite help. So it needs to happen before you're sexually active.
It will offer the best protection if the vaccine is given before sexual activity, because then she'll be covered against all the different types of HPV virus. Let's say she has had intercourse already, so she's already exposed to some. So the vaccine will not offer the best protection, but it's still beneficial to be given, because I think the vaccine supplier has done.
That's the thing. A lot of people now are now saying that Big Pharma is promoting that when you're sexually active, it still helps, but they don't tell you why and how.
Because they are actually doing. There's a lot of studies ongoing that suggest that even you have been exposed, you can still get some benefit from the vaccine that you're going to get, because the vaccine, for example, the latest one is covering against 9 types of HPV virus. So you may be exposed to only 1 or 2, so you can get still protection from the other 7.
Right.
Yeah.
It's very interesting. I spoke to another gynecologist a long time ago, and he said, the best present you can give a 16-year-old is a
HPV vaccine.
And for you to talk to Malaysians with regards to getting your 16-year-old daughter vaccinated in case she becomes sexually active, how do you even start that conversation?
Well, I would definitely vaccinate my girls.
My daughter won't have sex. You get stuff like but it is
being in this part of the world.
You understand where I'm coming from,
Being in this part of the world, being Asian, and this part of the world, parents don't really talk to their kids about sex education and all that. But I think these parents need to be informed. The benefit that the girls are going to get from this vaccination.
Right.
Yeah, you can potentially save them from getting the infection, and later we're talking about actually preventing cancers, because HPV virus has been proven to be very, very closely related to cervical cancer. They are the one that cause all this abnormal cell proliferation, that can eventually lead to cancer. So since we've found the causal factor here, I think we should do something to stop this. Yeah.
So let's use this part of the interview as a PSA. So your advice to parents, if they have growing girls in their house, is to get them vaccinated.
Yes, I would say so. Yes, please get the girls vaccinated before they embark on sexual activity, so they can get the most protection from the the vaccine. Yeah.
Right. Now let's move on to uterine fibroids, and pregnancy.
Okay.
Okay. So when you talk about fibroids, especially uterine fibroids, they say it in most cases it affects pregnancy.
Yeah.
Is that true to say that in most cases it affects pregnancy?
Yes, pregnancy with the uterine fibroid is definitely considered a complicated pregnancy, a high risk pregnancy. This mother is not going to experience the same, smooth sailing pregnancy like anybody. It's like the woman without a fibroid. Okay, the main thing is that you can have increased risk of miscarriage when you're pregnant with a fibroid. That's in the first trimester. Either it be a miscarriage or you can have abnormal bleeding also. And then eventually when you enter the second trimester, as the uterus grows bigger, because of all the hormonal stimulation, the fibroid also tend to get bigger. So definitely you're going to have a uterus that's larger than date, so you're like carrying the baby.
So
and also the
what
growing
can
fibroid.
be done at that point in the second trimester?
It's difficult because we try not to do any surgery on the uterus when the uterus is pregnant. Yeah, so basically we will have to manage expectantly until delivery.
Right.
So they will have to be informed. All the risks, for example, in the first trimester we miscarriage and bleeding. And in the second trimester, when the fibroid becomes too big, it sometimes can outgrow its own blood supply. That's when the patient can have a lot of pain.
Right.
Yeah.
From that, I wanted to very quickly digress to do's and don'ts during pregnancy. Now, OTC medications, are they safe to be used during a pregnancy?
Well, actually, there's not a lot of data regarding the safety of OTC medications. They are, in general, considered to be safe because you can get them without doctor's prescription.
Right.
Right. So, I mean, it's based on doctor's experience. Like for example, paracetamol.
Okay.
I think most pregnant women has taken paracetamol before, but luckily it's one of the safe ones. And it can be taken across all trimesters. So people take paracetamol for some fever, for some general painkiller and all that. So it's fine. Then the next one I think would be common would be for your cough and cold.
Right.
So actually, only chlorpheniramine is the only medication that's not contraindicated in all trimester, but it's a bit sedative, so it makes the mom a bit sleepy. But I guess the best advice is to go and see your obstetrician, so that he or she can prescribe you the right medication with the least side effect to the baby.
Right. Of course, I'm asking you a list of questions given to me by a bunch of women now. The second question is it okay to have a feeling of cramping or have some bleeding during pregnancy?
Cramp in the early pregnancy is actually very common because it's actually caused by the changes in the uterus. There's a growing baby there and the uterus is also growing in size, so you expect it to have some kind of cramps. It's very common that my patients come and tell me, I feel I'm getting my period, doctor, but I'm already pregnant, is that all right? So that's actually very common. And some light bleeding is also, not to say normal, but you can expect a little bit of minimal PV bleeding in the early part of the pregnancy because of the hormonal and all that. So your cervix becomes very sensitive.
Right.
So when you're coughing or you're doing a lot of walking or even sexual intercourse, you can have a bit of bleeding afterwards. So that's quite normal. You can just go and see your obstetrician, get a scan. If the heartbeat is there, it's fine. So you can just continue the pregnancy.
Right. This next question comes from a friend of mine who's a rather vain person. Okay. Even when she sleeps, she needs to look good. So her question is, how much weight should one gain in pregnancy? She's worried about not looking good while she's pregnant.
Well, across the board, usually the acceptable weight gain in pregnancy is about 11 to 15 kilo. This for a mother with a normal BMI. If the mother is underweight, obviously you can allow a bit more weight gain, probably up to 18 kilos. But if the mom is already obese, with high BMI to begin with, so the weight gain is a little bit reduced. You want to limit it around 8-9 kilos altogether.
So if they're already when their BMIs are quite high and they're pregnant, what is your go-to advice with regards to making your
weight gain optimum?
And also when you deliver, you want to be in the best in the pink of health as much as possible, simply because you don't want any complications. So what would be your advice?
My advice would be, first of all, I will refer them to dietitian.
You need strength to give birth,
I will definitely refer them to the dietitian so they can get some advice on, calorie counting and their requirement, what to eat, what not to eat.
During pregnancy?
Well, they will have to, because I'm going to be monitoring their weight gain.
Right. So every time they come in, they're not going to hear the end of it. If
Yes,
yeah.
So they still need to gain some weight. Yeah, so they have to restrict the weight gain, and then. Sorry, you were saying about obese.
About being a bit overweight while you're pregnant.
Because they have to be advised that when you're pregnant with the high BMI, there are bound to be complications. Your chances of cesarean section is a bit higher. Your labor tend to be prolonged, and then you're at risk to develop all these medical complications in pregnancy. For example, gestational diabetes mellitus. Right. So that's why it's very important to follow the dietitian's advice, and to stick to the recommended weight gain and not to exceed beyond.
Right. With gestational diabetes, it's also interesting to see that some women, after they deliver, of course, most of them come back to normal, but some women continue to have diabetes. What are the complications that are therein?
Well, women with diabetes in pregnancy, their actually risk to get diabetes in later life is a lot higher than women who doesn't have. So for those who remain diabetic at the end of the postpartum period, they are more likely to actually have the diabetes already even before they're pregnant. It's just that it's not diagnosed earlier. Right. So definitely they will have to be referred to the physician and endocrinologist to help monitor, because diabetes mellitus, as you know, is a condition without no apparent symptoms. They might go on happy with their life, eating, not restricting their, not taking care of their diet.
But it's clearly said
but without any symptoms.
With diabetes mellitus, it's clearly said that if you start to get dry throat, your lips are dry, you're thirsty, these should be alarm bells ringing already. Right. But of course, some of us are hypochondriacs, so we take these things more seriously than others.
But some are not. Some are just like, oh, I'm just thirsty, they keep on drinking, and then they can be actually diabetic for a few years even before they realize it. Okay,
so saying just before delivery, with gestational diabetes, you get a really high blood sugar level, the levels are really high. What do you do then?
Like in the labor process, they'll be monitored with insulin.
With insulin,
yes. In the antepartum period, they will be seen a dietitian, and they'll be advised to monitor their blood sugar. They will have to produce a blood sugar profile, we call it. Right. That's when they have to prick themselves and show the doctor their reading, reading of the sugar in a day. So there are a few readings that they have to take.
So you have to do it on your own?
They will be taught to do it, and then they have to do it themselves.
So that also will be checked against an A1C?
They'll have to bring the... Sorry?
Will an A1C be taken also?
Yes. Because some are very naughty. The day they're doing the blood sugar profile, they really will behave themselves. But on other days, they just binge on all the brownies.
From 5 p.m.
Yes. So that's when the HbA1c comes in handy.
Going back to more questions from women, what are the recommended vaccinations during pregnancy and when?
Okay, so...
Is that a valid question?
Yes. First, you will be talking about influenza, because it's safe to be given in pregnancy. So we should any adults should take influenza yearly, every year. So it can also be given to pregnant women, especially when they're pregnant around influenza season, or they're planning to go travel where there's a lot of influenza going on. Then next one will be the TDAP. It's actually tetanus, diphtheria, and acellular pertussis vaccine. This one can be given...
Can you just slow it down?
TDAP, okay. For tetanus, diphtheria, and I get that a lot. And acellular pertussis. Okay, so this is usually given after the 27 weeks up to the 36 weeks. The reason why we're giving is because we have been given this vaccine when we were younger, but our body tends to forget the antibodies we know of. So you have to boost the production of this antibody, and these antibodies can be passed on to the neonates, to the newborn, so the baby will be affected as well. Especially nowadays, you hear a lot about anti-vaxxers, and you see old disease resurfacing, people dying from TB, people dying from diphtheria.
What should we do with these people, the anti-vaxxers?
We'll have to talk to the minister.
Is it safe to exercise, and what sort of diet should one follow? Of course, this is a very general question. I think this question, there's a lot of depth to this question, but we'll get to that.
Take a whole topic on its own.
So is it safe to exercise? Also, I think in a roundabout way, she's asking,
do I have to exercise?
Do I have to exercise? And can I, get jiggy with it during pregnancy?
It's safe to exercise in pregnancy, okay, provided you know your limitations. If you are someone who has never had exercise before in your life, don't suddenly try to start exercising in pregnancy and doing very vigorous exercise. So you know your limitations. Maybe you want to start small, maybe 10 minutes walk 3 times a week, and you increase it from there on, okay? And you have to know there are certain exercise that's not recommended in pregnancy. For example, with the risk of falling. You don't want to fall when you're pregnant. It can cause injury to yourself, when there's sudden trauma to the abdomen, that's going to increased risk to the pregnancy. So the safe exercise to be done in pregnancy would be, I would say, would be brisk walking. You know, just take a walk in the park or around your housing area, and swimming, of course, because in the water you're like protected from any kind of injury. Yeah, and
now
no
one
risk of
final
falling
question
there.
from a list of questions sent to us by women. What pregnancy symptoms are normal and what's an emergency? That's a very good question.
Yeah, that again a very broad topic. You know, we started with cramp just now.
Right.
Remember, I told you cramp was actually very common and can be normal in pregnancy, but they should know that if the cramps doesn't go away, okay, or if the cramps gets worse and the bleeding increases, and you have to think about miscarriage and all that. So that's not normal, and you should see the obstetrician. Okay, you should also look out for other symptoms like pain during passing urine, cramps, and then pain when passing urine. You have to think about urine infection, and again, will require you to see the doctor. Yeah, and this is talking about the first trimester. Going into the second and third trimester, of course, bleeding again is not normal in pregnancy. You have to rule out all the causes related to the placenta, whether the placenta is normally situated or the placenta is healthy, whether there's any premature separation, all the causes. So again, you need to see the doctor. Yeah, this is talking about cramps and bleeding. Then I guess when you go to the doctor for your normal antenatal visit, there are a few things that they will look at. For example, your blood pressure and the presence of protein in the urine. This again to try to screen for preeclampsia, which is hypertension in pregnancy. Again, not normal.
So hypertension in pregnancy is not normal. Gestational diabetes is, yeah? Which brings me to, now that we've talked quite a bit or extensively about the technicalities, but I mean, we covered enough ground. It's time to move into you being a doctor and talking to people. And it's a little something we talked about off the airwaves. You know, like for me, it's always a wonder how doctors have to break bad news to their patients. You know, if one's got cancer or if there's some complications with pregnancy in your area of speciality, you need to break bad news to a couple or to a person. How do you do it?
Well, it's never easy. You know, first of all, you have to be very sensitive to what the patient is going to feel. You know, breaking bad news is not easy. You might want to bring her to a room, okay, and then make sure you switch off your handphone. You want ask her whether she wants someone to come in with her to you know, to listen into the conversation. She wants somebody to be there for her. And then I will slowly tell the patient. I usually start the conversation. For example, like a woman who just lost her baby. I would just start the conversation by saying, this is not an easy thing to tell you. I myself have never experienced this, so I know it's not, I can never understand the sadness that you're going to go through, but I'm very sorry. I have to tell you that your baby has passed away in the womb, okay? And
so I think
I'm just going to give you a minute, and then you can ask me anything that you want to ask me later.
What's, I know this is putting you on the spot, but what's the worst you had to do as a doctor in order to break a piece of news to someone? You know,
there was this lady, she was followed up somewhere else. She was told everything was fine. But when she came to my hospital, I was working in PPUM that time. I was still a registrar. So she was referred to the hospital because the baby has had a very bad structural abnormality that will result in the baby dying soon after birth. So I was working with the high-risk pregnancy team at that time. The finding was confirmed by my professor. So I was the one assigned to break the news. The husband did not take it well. He was like shouting and screaming. Because they had been following up somewhere and they were told that everything was fine right until like at 38 weeks. It's just like near birth, near delivery time. Then bam, someone told you that the baby has got, you know, some congenital problem. So it took me quite some time to calm them down and you know to.
I mean, doing ONGs or specializing in this field, I guess there's a lot you have to take into consideration, especially when speaking to people now. Before I let you go, what would your message be to all of us with regards to understanding the work of an ONG specialist or an obstetrician and gynecologist?
In private practice or in the
in
government?
Private practice, I mean, we expect a lot from you, you know, especially when we go to private healthcare, we expect a lot from people like you. But also there's a flip side to it, which is problems within your work or areas that, you know, sometimes which is beyond your control. So what would you like to tell all of us with regards to dealing with an obstetrician, gynecologist, and also, you know, like a lot of us like to go doctor shopping these days, you know, and we do it very openly. I think it's a bit crude, but
Okay, being a private obstetrician and gynecologist in a private setting, it's not an easy job. Because when patient comes and start their follow-up with me, they would expect me to deliver their baby. Okay, and as much as possible, I would also want to be there during the delivery time. But I guess they have to understand that sometimes things do happen. You know, you get, because we are also at the same time human being. I have family and I have my husband and my kids. So if we have like emergency at home, then you cannot come on time. Then I hope my patient will expect the fact that, you know, like they can accept the fact that they may be delivered by someone else. That's one thing. And I think sometimes patients tend to request phone number from their doctor. You know, it depends. You know, if like I try not to give, but there are certain circumstances when it's like a high-risk pregnancy and this patient is very concerned. You know, I do tend to give, but I really would request that they respect the trust that the doctor is giving.
Of the,
Yes, this is a privilege to, I mean, only call when you really need to, when there's a really emergency, and not to just call and chat. And you know, because we are at the end of the day, we are human beings.
Right.
Yeah, and I'm already giving like half of my life for my patients, so I need some time for my kids and my family at home as well. So yeah.
On that note, thank you very much, Dr. Sharina Muhammad Razali, consultant obstetrician and gynecologist from KPJ Damansara Specialist Hospital. It was a pleasure and honor having you on the show. Stay with us. We're going to take a short break and we'll come back with more for you on Medical Today. Welcome back to the final segment of Medical Today, Episode 8, Season 3.0. And as always, in Season 3.0, we have a video for you on first aid mistakes. Now, we all have been through this, whether it's a sprain or fracture or a strain, we have always applied heat to it. Now, is that the right thing to do? Well, some are saying that there are better ways of dealing with this. But as always, before we even play the video, please, if there's an emergency you can't handle, call 999, get advice, and get the right people on hand to help with that emergency. On that note, let's take a look at a video about the mistake of putting heat on a sprain or a fracture.
The mistake: putting heat on a sprain or fracture. Heat can be soothing for aches and pains, but you shouldn't apply heat to a sprain or fracture. This will worsen inflammation. Ice helps decrease swelling, whereas heat boosts blood flow, which can make swelling worse. Save heat for issues like back spasms. What to do? You can apply ice or an ice pack for about 20 minutes. To make an ice pack, put ice cubes in a plastic bag that seals at the top. Wrap the bag in a clean, thin towel or cloth to protect your skin. Never put ice or an ice pack directly on the skin. Use the RISE treatment of rest, ice, compression, and elevation for the first 24 hours. But do consult with your doctor as soon as possible to get medical treatment immediately.
So there you have it, a little video for you with regards to some tips on how you can deal with putting heat on a sprain or fracture. Well, the thing is here is to not use heat at all, but to use ice. Well, if you want to know more about this, just Google RICE, R-I-C-E. That acronym will help you deal with problems like this. As always, if you do have any comments or if you have a question for us, send us an email. Send it to ask@medicaltoday.my. That's ask@medicaltoday.my. We'll be more than happy to feature your questions or to have whatever you want for us to be put on the airwaves. We can bring around subject matter experts or doctors. If you request for them, we'll try to get in touch with them and have them on the show. Once again, send me an email. Send it to ask@medicaltoday.my. That's ask@medicaltoday.my. Don't forget, next week's show, episode 9, we'll be talking to Dr. Muhammad Muzaffar Hamiruddin from KPJ KL Dental Specialist Center. Of course, we'll be talking about dental health and teeth without teeth. What's that all mean? Join us next week. In the meantime, Jared Ratnam signing off. You have a fantastic day ahead and a great week. Bye-bye.